Good afternoon, everyone. As I said, I'm Maria Taylor. I'm co-principal of Wishmore Cross Academy, which is near Woking in Surrey. I'm here today with my other co-principal, Jed Donnelly, who's sitting over there. Do you want to give everybody a wave, Jed? Thank you. Wishmore Cross we're part of an academy chain, the Academy's Enterprise Trust, and I think currently we've got about 67 schools within that chain. It's the largest chain of academies in the country. So, Wishmore Cross. We're a residential special school for boys predominantly aged 11 to 16, so secondary, who all have either a statement or an education, health and social care plan for social, emotional and mental health needs. You might have heard of EBD, BESD, SEBD. Our designation changed with the Special Educational Need and Disability reforms in 2014. So behaviour was taken out of the designation and mental health put in. And I'll talk about it a bit later, but that's actually it was quite a significant event in our journey into restraint reduction. We just opened last year a primary unit for years 5 and 6, and that's really helping our transition from primary school to secondary school, because children can now just stay with us rather than having to have another move at the age of 11. We have a huge range of children with a huge range of disabilities, predominantly ADHD, ODD, OCD, Asperger's, very, very mild Asperger's. All of our children have been excluded from numerous mainstream schools, 3 or 4 several times, normally for aggression and violence towards staff and peers, and all of them have experienced some form of trauma in their lives. So, why did we want to go down the restraint reduction route? It was common practice, and it still is common practice, I'm sad to say, in many special schools, and particularly schools for children with social, emotional and mental health needs. We had 5 outstanding social care Ofsted judgments. We've been good for our last 3 education Ofsteds. Restraint was never mentioned as an issue in any of those Ofsted inspections. But for Jed and myself, actually, the use of restraint, we never actually felt comfortable with it. Our core principles and values, in our organisation, we felt that actually we did not really want to use restraint. However, we didn't really have any other tools in our toolbox, and as I say, it was common practice. So, in September 2014, we had some new staff that needed training in MAPA, and previously we'd had an in-house trainer, and that person had left. So we invited CPI in to deliver a MAPA programme, and I attended that programme, and I was quite shocked at the change in the delivery of the programme. The content was much more towards de-escalation and prevention rather than actual physical skills. And the instructor pointed out that, the reasons why we should be using restraint, last resort. And actually, it went through my head, actually, this isn't our practice in our organisation. And there's something not quite right here. Alongside that, in September 2014, Ofsted introduced a new framework. And in the guidance under behaviour and safety for inspectors, it actually said that inspectors should be looking to see a reduction in the number of physical interventions and restraints in schools where it was used. So, we began the journey. So, a precursor to that, we already were using restorative justice practices. We already had nurture group practice and training, and all of our pupils had Boxall profiles, and we already had a therapy team in place. And I think what's important to mention there is that many schools say they use restorative justice practices or they have nurture groups, but it's not a whole school practice. 5 or 6 staff might be trained in restorative justice. You might have a nurture group that children attend for an afternoon a week or 2 afternoons a week. And for us, it was really important that these practices are a whole school and all of our staff have a consistent approach. And then I began the degree programme at Wolverhampton in October 2014. So as part of that degree, I had to sort of research models of restraint reduction. And so I looked, there was a lot of work, there wasn't too much work really done in the UK, a lot of the work had come from America. And there wasn't really much research on schools and education and how restraint had been reduced in those environments. But there were some common themes. So there was leadership and management, data, risk assessment, debriefing, workforce development and prevention tools. And I looked at the work of Alan, I looked at the 6 core strategies, I looked at the DeVoe and McGill work from the Tizard Centre, and I also looked at positive and proactive care. And interestingly, as a school, we hadn't heard about positive and proactive care. We don't get documents sent to us that are produced by the Department of Health. So, you know, when we had that initial MAPA training in September 2014, positive and proactive care was new to us. So I decided that actually I would use Huckshaw's 6 core strategies because, and I'll just put them up, we all know what they are, so I'm not going to go into those in great detail, because I felt that actually for some of those strategies there were all elements in school already in place, and that it was a model that could be easily adapted to an educational environment. So we started off with leadership and management. Now, Kevin Huckshaw says that you know, for any intervention to take place and for a culture change, it must begin with leadership. At that particular time, in the previous academic year, we'd had a change in our leadership team, and that actually allowed us to go forward with a restraint reduction programme. All members of the senior leadership team seriously believed that we wanted to reduce the amount of restraint in our organisation, and we were all singing from the same hymn sheet on that. And that actually enabled us to articulate a clear path and philosophy across the school. We had to be careful about the language that we used. You know, we had some senior staff who were telling other inexperienced staff to be more proactive. If a child was kicking the door, be proactive, stop them doing that. How did they do that? Holding them, moving them. So as leaders, we had to be very, very careful about what we were trying to articulate to staff. During the degree programme, we talked a lot about culture, and that was on the back of really Winterbourne View. And is our culture corrupt, or is there a culture of mutual respect? And some of the things that we talked about on the degree programme started to ring alarm bells. And I'm not saying that our culture was corrupt by any means, but it was simple things like, are your staff treated differently to your service users? And one thing struck in my mind, and this is going to sound really, really silly, but at lunchtimes, staff were allowed salt on their lunch. Pupils weren't. Now that's come from the Healthy Schools programme, which is fair enough, but either everyone's allowed salt or nobody's allowed salt. And it's those little things that, if they're not nipped in the bud very quickly, can cause your organisation to become corrupt. As I said earlier, we had to model the behaviour. So we were careful with our language. We were modelling de-escalation techniques, trying other things, thinking out of the box for children, and actually agreeing that we would only ever use restraint ourselves as a senior leadership team if it was very, very last resort. So just modelling our practice to the rest of the staff. And then as part of the leadership team, we needed to oversee and manage all the other strategies. So what I did when I looked at Huckshorn strategies, I changed them around in the order in which we worked with them, because I felt that actually, for us, workforce development would become the next priority. Because you can't ask staff not to stop using physical intervention or restraint if you don't give them other skills and strategies to use. So we wanted to develop the skills of all staff. So as I said earlier, we've already talked about that all staff had nurture group training, all staff had restorative justice training. And by all staff, I mean all staff, right down from the catering staff, premises staff, everybody had that training. Okay. I then noticed that the staff that had received the MAPA training in that September of 2014, in that first term, hadn't carried out any physical interventions. All the physical interventions that had been carried out were from staff who'd been previously trained without using the workbooks, which actually was quite unusual, because prior to that, what you normally used to see is if staff had been trained in MAPA, actually you'd get a spike in the use of MAPA. So what we decided to do was that we would retrain everybody in MAPA again using the workbooks. On the degree courses as well, I was the only person there from education. Everybody else was from health and social care settings, and we were talking a lot about mental health. And a light bulb suddenly came on in my head, and which is why it's important about the change in our designation, because actually we were very good at using lots and lots of different behaviour management strategies, but actually what we weren't doing was dealing with the mental health needs of our pupils. So what we did was we gave all of our staff training in mental health, and it wasn't in-depth training. It was really quite simple training, because we didn't want to confuse them. We didn't want to use lots of long words and stuff, because it would just go over their heads. So they had training in recognising the symptoms of mental health, because there are issues. All of our children have a special educational need, but actually what's normal as part of their special educational need and what actually then is starting to become mental health. So a child with ADHD or ASD will have some form of anxiety, will have some form of depression, but actually at what stage does that become something else and a medical issue? We then also looked at trauma-informed care. Previously, we used to wait until challenging behaviour got to a really, really high level before we started to investigate what might have been going on in that child's life, either currently or in the past. And then by then, it was actually sometimes too late to put interventions in, particularly therapeutic interventions, and children would have to move on to another provision. And one of the things that actually, I'll just go forward one slide, is, again, we just did simple things like showing a picture, a scan of a brain, of an abused brain and of a normal brain. And actually, staff, when you say to staff, actually, how can you expect a child to manage themselves and work with strategies that you would use with a child with a normal brain? There's huge gaps in that brain. And seeing it visually really impacted on staff, because it made them realise that actually they needed to sometimes change the way they were doing things with these children. Okay, we then did a lot of work on the myths regarding restraint. We have a very, very stable staff. They've been working in SEMH environments for years and years and years. And they truly believed that the use of restraint and physical interventions keeps people safe, which on occasions it does, but also there are huge risks surrounding the use of restraint. So we did an awful lot of work about that. They often thought that children wanted to be restrained. They wanted to be held because it made them feel safe. So we talked a lot about re-traumatisation, as Iris has just spoken about earlier, about how actually it can re-traumatise children. And all the work that we've done in therapy and supporting those children, we can just wipe out with just one hold. We also talked about, as well, us allowing pupils to carry out incidents, because if we stop them, so if a child, for example, is trashing a classroom, if we stop them every time they try and trash a classroom, we're not teaching them self-restraint and and how to monitor themselves and self-regulate themselves. And we're also taking away the ability for them to realise the consequence of their actions and repair the harm, which is actually a much more difficult thing to do than holding them and preventing them from trashing a classroom. So we did a lot of work around that with staff. We also then gave all of our staff supervision. So every member of staff has supervision once every 6 weeks with the educational psychologist. They're large groups. It's not ideal. It would be much nicer if they could just do it within groups of 4 or 5, but resources don't allow that. And within those groups, we do a lot of work on rational detachment, and actually not so much about the children's behaviour, but how the children's behaviour is making those staff feel. So the next thing we looked at was, Huxhawn would have called this consumer involvement, but for us it's pupil and parent involvement. So we always carried out home visits for every child that we admit to the school. But quite often those home visits, we weren't getting the information that we needed during those visits. Most parents or carers have got not a very positive experience of the education system. Their children have been through numerous establishments. They might have their own issues with education from when they were a child. Quite often there's lots and lots of professionals involved with these families, and they've just had enough by the time they get to us. So we changed the way in which we did the home visits. We used to go in with a questionnaire and paper and writing all the answers down. So we decided to just go to this, do a journey. And we've talked a lot about journeys over the last couple of days. So we go in with a timeline. And so we want to know where the child's been and where the parents and the child want to end up. So this is an example of a child who's currently in year 9. And we can see he was born in 2003, it's a normal birth. Parents split up in 2004. When he was a toddler, he had tantrums, difficult to potty train, he was aggressive, he was destructive. Started nursery in 2006. There was some CAMS involvement there, which Mum said wasn't particularly helpful. Lots of incidents in his nursery. In 2010, he was diagnosed with ADHD and medicated. I had a sibling born in 2001. Started another primary school in 2011. Another sibling born in 2012. 2013, he was diagnosed with ASD, anxiety, ODD, conduct disorder, and sleep issues. At that stage, he then began to refuse to see his dad. And just before he started with us, his uncle had stomach cancer and his granddad died. So quite a lot of trauma in that young life already. Mum, she wants him to succeed in life, to do well, achieve his goal, and be settled down by year 9 and 10. Well, actually, he's in year 9 now, and I would say he's fairly settled. We've got Mum's nightmares about the worst things that could possibly happen. And we've got our building blocks here. What can we use to support him? What's there already that we can use and we can build on? And then his likes, really, really important, football, sport, football cards. So staff very, very quickly can see that child's life and what they can use to grab that child and engage that child. What are his likes? So that map allows us to identify potential any previous trauma. And it also allows us to identify what's important to the parent and the pupil. And that then feeds into our data that we're collecting about that child. Pupils, we have a school council, as do most schools, but we talk about the use of physical intervention and the use of restraint on a school council. And you'll see some of the comments towards the end of the presentation. Pupils also they have their own interview panels for staff. So we do that. So there's quite a lot of pupil and parent involvement. Okay. The next strategy, prevention tools. So we always carried out risk assessments. We always had a risk assessment for every child, but actually we never used the information most of the time that we got from the parent visit and the home visit into that risk assessment. So, for example, we've got one pupil who, for him, it's really, really important that he's allowed to play football at break time. So that is in his risk assessment, that he is allowed to play football and there is a football available at break time. A couple of weeks ago, the football burst and we didn't replace it. Big issue. We also use, there's a document, a DFE document called Mental Health and Behaviour in Schools. And within that document, there are a list of risk and protective factors. So we identified those risks and protective factors from the home visit, and then we put that into what we call a vulnerability index. So each child, we look at different areas and it's scored. So for example, if a child is tier 3 CAMS, then that's a 3. If they're tier 1, it's a 1. If they're involved with social care and they're on a CP plan, that's a 3. We then add up all those scores, so the higher the score, the higher the risk. And that actually allows us to identify certain areas where we need to target resources for certain children. As I said earlier, every child has a Boxall profile target, and that's really, really important because quite often when children experience trauma, that can inhibit their development. So if in a classroom situation, you've got a child with huge gaps in their development and you're asking them to do something that's way above their ability, A, that's emotional abuse, and B, actually it's a flashpoint for confrontation. As I say, we use restorative justice processes. All of our staff use a common language of I feel, talking about repairing the harm. So it's not a punishment environment. It's very restorative. Okay. We've talked earlier about the environment. We have to manage our environment. For some children, it might be too hot in a classroom, it's too overcrowded in a classroom, there's too much stimulation, not enough stimulation. And we do have to recognise that actually for some young people, a school building isn't the right place for them to be educated. Many of our young people are tutored at home. They're tutored in the local library, they're tutored in youth centres that we have, and they really, really achieve well. But as soon as they come into a school building, that's it. Thank you. So we also use positive behaviour support. We'd like to do a lot more on that, but actually resources are an issue there. But we also have to accept as well that some behaviours we can't stop. We might be able to change them to make them more amenable to us, but we do have to have that recognition that we're not going to be able to change all behaviours. Okay. And this one's really important, remove petty rules. So when we analysed our data, there was one young year 11 who every morning in Breakfast Club was turning over tables and chairs. And this was happening on a daily basis. So when we looked to see why that was happening, the staff said, well, it's because he wants 3 sugars in his tea. Okay, so why can't he have 3 sugars in his tea? Well, the rule says he can only have 2. Well, I'd never heard of that rule. I don't think Jed had ever heard of that rule. And so what? So what was happening with this child? He's a prolific cannabis user. So he was getting sent home, using cannabis all day, coming back the next day, being refused 3 sugars in his tea, going home, taking cannabis all day. So, when we said to staff, actually, what's worse, 3 sugars in his tea or him going home and using substances? I think the 3 sugars myself. So, there's lots of those rules that you might not know about in your organisation that happen, and they happen for who knows why, and actually can be the cause of confrontation. Data collection. So again, we already always collected data on types of incidents, where the incidents happened, who was involved, times of day, all of that stuff. But actually, and we analysed the trends, as you can see from the sugar incident. But actually, we now use the data from the vulnerability index, from the home visits, from the risk assessments. So that all feeds into our data collection. And then it feeds back into prevention tools. Okay. So we're just actually, and then obviously we debrief all incidents. We only used to debrief physical interventions. Now any intervention that requires a serious incident form to be completed, we debrief on that as well. Okay, so has the programme been successful? So we have managed to reduce, over a 3-year period, we have managed to reduce the number of physical interventions as a percentage of the pupils on roll from 16% in 2013-14 to 1.8% in the last academic year. And that 1.8% actually relates to 3 interventions in the autumn term of that year, and actually they weren't even holds, they were disengagements. So we've significantly reduced the amount of physical interventions. Alongside that, which we didn't expect, we've significantly reduced the number of days lost to exclusion from, in 2013-14, 305 to 101.5 last year. And then in addition to that, which was even more unexpected, considering, senior leaders were telling staff, be proactive, stop children kicking doors, stop children causing damage, we've reduced the amount of vandalism expenditure by more than 50%. Now, let me see if this works. This is just some comments from children.
I have not been restrained once. I was restrained quite a lot from.
I've been to since year 8 and I've barely been restrained. And my last school I was restrained once or twice a week. At the crew they restrained you if you got angry because they didn't know how to control you. But what is the point of restraining you, as you need to know how to control your own anger?
I feel better in the school. There are less kids, less pressure, and more kinder teachers who don't yell at you constantly.
I was restrained a lot in the crew. 2 big blokes used to put me in the room and shut the door and left me. There was no lock on the door, so I couldn't get out.
That was a year 11 pupil who came to us in year 7, so he still remembers an incident that happened over 5 years ago. This is what staff say. I'm sure these are going to be published, aren't they, these slides? So you can read those at your own leisure, and what Ofsted said as well in our last inspection. So they were happy that we've managed to reduce the amount of restraints. Where next? Well, ideally we'd like to be restraint-free. We recognise that that might not be possible, and there might need to be. We might need to use physical intervention as a last resort. We need to continue with the staff training. Any new staff, we talked about this yesterday, any new staff need to be trained, and staff need continual reminders about their training that they've already received. We're hoping now to use the 6 core strategies as the model to reduce fixed term exclusions, because I think it's a really, really good model for any change agent. We need to support our feeder schools, because we've got an issue now with children who are coming from other schools where restraint is being used on a daily basis, and their behaviour has been managed by the use of restraint, and they're testing our boundaries.
You're in the red zone.
Right, okay, 2 more minutes. Okay, going back to what Craig was saying earlier, we put in a bid for some CAMS transformational money to deliver the mental health training that we delivered to our staff to 10 schools in London Borough. We've actually got 140 schools to deliver training to, so that's going to be quite a challenge. And also, we want to continue to lobby the DFE for updated guidance for schools. I spoke to Norman Lamb earlier and asked him what his thoughts were about, we've got this new guidance for over 18s and we haven't got any guidance for children yet. Restraint is going on in daily basis in our schools. It's not being recorded. There's no national picture of the amount of restraint that's used in our schools, and he said it was a scandal. Thank you.
Thank you very much.